Nearly 1,800 Providence nurses and clinicians are officially on strike at 2 local hospitals. Nurses are picketing outside both the Providence Portland Medical Center in Northeast Portland and Providence Seaside Hospital.
That strike officially started at 5:30 this morning. Our Devin Haskins has been live outside Providence, Portland, and Northeast Portland for us all morning long. Devin, walk us through some of the details and how this is all going to look this week.
Yeah, right now, as you can see behind me, the sidewalk here on Northeast Gleason completely lined with nurses now on strike. And as you said, that strike happening at 5:30 this morning. Of course, with any strike this morning, we've seen signs, we've seen chants, loud music, and a message to management. Some nurses telling me they were escorted out of the hospital at 5:30 when this strike began. Replacement nurses or traveling nurses are now caring for any patients inside. On Sunday, nurses said the hospitals covered walkways with curtains. They claim it was a way to prevent nurses from seeing replacement nurses walking in. Providence says they're also having replacement nurses enter the hospital away from those on strike. Negotiations here with the union have been ongoing for the last 9 months. The last bargaining session between Providence management and the union, the Oregon Nurses Association, happening on June 19th. The nurses say they want higher wages, better health care, including mental health care, and more paid time off and sick leave. Providence says their latest proposal included a 12% raise in the first year and 30 more hours of PTO. Earlier this morning, just when that strike happened, I talked with Richard Botterell, an ER nurse here at Providence Portland. He says it's more than just that.
There's way more than that. There's way more behind that. And you know, the additional PTO is a dump. We're not increasing our accrual, so it's a very temporary thing. The amount they're offering on a yearly basis doesn't even cover a shift. So if we have to take a day off, we still are taking some of our own time off to have that time off.
While nurses picket, Providence officials say people should expect longer wait times at the Portland location here. Only necessary surgeries will happen. All electives have been paused. The neonatal unit, ICU, is closed, and baby deliveries will also move. Providence says that while this strike happens, so over the next 5 days, Providence will not meet with the union. They will wait until after this strike ends to restart those negotiations with these nurses.
Sunrise reporter Devin Haskins is live for us outside Providence Portland Medical Center there in Northeast Portland. So Devin, tell us about what's happening there this morning.
Yeah, as you can see behind me, a big group of nurses now on strike here on Northeast Gleason, outside the Providence Portland Medical Center here on Northeast Gleason. That strike happening at 5:30 this morning and lasting till 7 o'clock p.m. on Friday. So for the next 5 days, nurses will be on strike right out here at this location, as well as at the Seaside location over there. Joining me now, Kyle Cook, a surgical oncology nurse at Providence Portland, but also a member of the bargaining team and a nurse that's currently on strike. So seeing this group of nurses here on the street, we use nurses as kind of a general term. Who is out here right now, kind of the types of nurses?
Yeah, so we have all of our represented nurses are out here. You have surgical nurses, ICU nurses. We have some of our clinicians from home health and hospice out here as well. They're out here advocating for patient safety. They're very encouraged, very spirited. Out here earlier this morning, making sure that the community knows that we are fighting for them as well as our families and our colleagues.
Break down the number. We've been hearing about 1,800. All 1,800 not here at Providence Portland. Kind of, how is it broken down?
For sure. So we're about 1,300 represented nurses at Providence Portland, and then we have 400 in the community out at home health and hospice, and I believe it's around 100 out at Seaside.
And this is it just happened that all the nurses' contracts opened at the same time, right? So it's not ONA. ONA represents them, but ONA not going on strike at the same time for each.
Yeah, so we've been bargaining basically in good faith since last October. Our contracts expired at the beginning of the year, and we've been bargaining all through this year, as well as a 19-hour marathon session 10 days ago, trying to reach an adequate contract for our nurses in our community, and they're not.
Talk about that contract.
Yeah, so basically what we're advocating for is safe patient care. And what does that include? That includes making sure that we have adequate staff, making sure that we're having a compensation package that is bringing valuable nurses, recruiting them, respecting them, retaining them, and bringing them to our hospital. We are not at parity with our other hospitals, OHSU, even St. Fee's, Legacy, and we are wanting to make sure we have that, so that we're bringing that valuable experience to our hospital and providing for our community here in East Portland.
All right, Kyle, thank you very much. So as you hear the Hawks go by, you hear the crowd cheering, or the nurses on strike cheering for those cars. advocating again for that contract that they're hoping to fight for. Now, the strike ends at 7 o'clock on Friday night, but nurses say that they can't go back to work until 7 o'clock on Saturday morning because that's when the Providence replacement nurses are contracted through.